Hello everybody, this is Ryan Beck, Orthopedic Sports Medicine here at the Orthopaedic Institute of Western Kentucky, coming to you today with a shoulder topic for National Elbow and Shoulder Week. We're going to talk about slap tears in today's video. Slap tear is a lesion that occurs involving your biceps tendon where it attaches to the top of your labrum in your ball and socket joint of your shoulder. The labrum is the rubber gasket or ring that helps hold the ball in the socket, and the biceps tendon, as you all know, is the top of a muscle that helps you bend and rotate your forearm, and sometimes tractional injury or repetitive injury can result in a labral damage, and I'll show you how that is. This model shows the biceps tendon running up through a groove on your humerus called the bicipital groove, and it goes over the top of the ball into the socket. Okay, it is between the top rotator cuff muscles and the front rotator cuff muscles. Interestingly, the long head of the biceps is one of only 3 tendons in the body that occurs in a joint. You have the long head of the biceps in the shoulder, the popliteus tendon in your knee, and the flexor hallucis longus in your ankle. Now, this model is hard to appreciate, but you can see as this biceps tendon dives into the joint, it attaches to the top of the labrum, which is the socket ring from your shoulder joint. And I've got a graphical representation here. Your glenoid is not a round platform, it's actually kidney bean shaped. And the labrum is this rubbery structure all the way around the outside that keeps the ball in the socket centered optimally. The long head of your biceps tendon actually attaches to the top of that labrum, and sometimes a tractional injury or a violent injury to the long head of the biceps tendon can cause a tear at the interface of where that labrum attaches to your glenoid. And that's where we get the acronym SLAP, S-L-A-P, because it happens at the top or the superior aspect of the labrum, SL, and it tears from the front anterior to the back, posterior. So SLAP, hence SLAP lesion. Now, your doctor or provider may be talking to you about this, and they'll probably reference an MRI. And most of the time, it is easily visualized with a special type of MRI called an MR arthrogram. But as you can see here, you can see the black tendon of the bicep tendon wrapping over the top of the humeral head and then diving towards the glenoid. This individual does not have a fully displaced slap tear, but you can start to see some signal track underneath that triangular rubbery labrum as it sits atop the glenoid. And if that were to fully transect that triangle and displace it, that would be a grade 2 or a slap tear that is displaced that your provider would likely discuss treatment options. And that can range from simply cutting the biceps tendon and debriding away that labrum versus reattaching it further down the arm. And in some cases, in younger individuals, it may even include going through and tacking that labrum back down. Thank you, everybody. This is Ryan Beck talking about slap lesions. Remember, not every issue has to result in surgery. There are plenty of options to treat your pain and your symptoms with physical therapy and with injections. Come down, let us evaluate you, let us take care of you. Have a wonderful day.